My name is Megan Vickers. I'm a physiotherapist and I specialise in ante and postnatal rehabilitation. I'm going to take you through abdominal massage, a self-treatment that you can do at home. It's really essential to help with diastasis recti recovery, abdominal healing, post-C-section, post-abdominal surgery, with pelvic floor dysfunction, prolapse, incontinence, and also with any breathing difficulties. Our abdominal wall is the wall of the pelvic floor and the diaphragm is the ceiling. So any dysfunction through our middle section may benefit from release of the abdominal muscles. So we're going to start in kneeling and we're going to work on first the outside muscles, the obliques. So I'm using today a really nice healing balm by my friend Womanology, but you can use any oil or massage cream just to help you nourish those tissues. If you have got a wound, you just want to start really gently sweeping through your tummy. Always go in a clockwise direction so that you are following the normal movement of your gut. It's easiest to do it when you're upright after getting out of the shower before you get dressed. But if you are quite sensitive, if there is a lot of pain here, you can do this lying down as well. Okay, so once we've warmed up those tissues and we've moisturised our tummy with an oil or balm, we're going to start to get into the waist. So if you divide your tummy into 3 sections, so outside section, middle section, outside section, we're going to work on the 2 outside sections. So these are where our oblique muscles sit. So the first thing I'm doing is just stretching those muscles down, massaging into them, just as you would a back massage. Straight away I can feel a few sore points. Those muscles in me like to get quite active, as they do with most of us postpartum, particularly if there is a separation through the midline. So I'm putting quite a lot of pressure through here, so a firm pressure, again, just as you would in any massage anywhere else in your body. And I'm trying to breathe comfortably. I'm not holding my breath, I'm not taking any particular sort of breath. I'm just trying to breathe as comfortably as possible. I'm letting my body get used to this pressure before we get a bit deeper into the muscles. So after a few minutes of just gently stretching at that tissue with our hands, we're going to find some trigger points. So trigger points are essentially a bunched up muscle, knots in a muscle, where the muscle is most crossed over, where all the fibres are bunched up together. It can feel quite firm underneath your fingers or just quite sore. So for me, I'm going to start to just track up that outside third. I'm going to start on my right hand side, and through here I can feel a very tender spot. Now as I put my fingers on that, I can feel sensation of discomfort up here through my middle and a little bit out. So with trigger points, we're going to put that pressure on with our hands and we're going to hold it for up to 90 seconds. That's how long it takes for the muscle to let go of its contraction. It's already starting to settle. That referral's there no more. It's still a little bit sensitive underneath my fingers, but I can't feel it referring up anymore. So I'm just going to hold that a little bit longer. If that doesn't start to ease, if it starts to spread, if it gets more sore, if the referral point doesn't change, I would back off and find another point. It may not be a trigger point that you're pushing on. So for me now, that just feels like I've got my fingers on my tummy. All the pain has gone away. So I'm going to take my hand off and I'm going to travel up that same lateral line, finding where my obliques merge with my rectus abdominis, my 6-pack muscle. And there again, I can feel another tight point. Now that one's referring up this time, so I can feel a pain line coming up towards my rib cage. Doesn't mean there's something wrong with that muscle, it just means that that's a strong muscle and that's an active trigger point in that muscle. So a lot of the time when we talk about pelvic rehabilitation, pelvic floor rehabilitation, tummy muscle rehabilitation, we're talking about activating or switching on your deep muscle group or a part of that muscle group. So if something isn't active, if something needs switching on, it makes sense that other muscles have started to compensate for that. So we have overactive muscles or dominant muscles. And that's exactly why this muscle release is important. If we take the tension out of those dominant muscles, those ones which are working too much, it gives the ones which aren't working so efficiently a greater chance when we're doing our rehab exercises. So again, I can feel nothing in that muscle now, so I'm going to take my hand away. You can see that it's starting to get red, and that's not a sign of me hurting myself. That is the blood being drawn into the area. That is essential for healing. I'm going to come down to the other side now. So again, if I think about thirds through my tummy, middle section, lateral sections, I'm going to come down now. So I've travelled up my right hand side with my up colon, and I'm going to go down my left hand side with my down colon. Now my right side is generally tight all over, and my obliques are no exception. So it's harder for me to find a trigger point, but there I can feel when it actually refers right the way over to the other side. Referral points are totally normal, as well as when you hold that trigger point, the referral point should shrink all the way back down to your fingers. So again, I'm going to hold it and just breathe normally. If I take really full breaths, it can make that quite uncomfortable as my tummy muscles press out and up into my fingers. And I'm not going to fight myself here, I'm just going to hold that pressure. This is already easing a little bit quicker than it did on the right hand side. It just feels like I've got my hand there now and no pain. So I'm going to travel down. There's another point right there. And that travels down towards my pubis and out in towards my belly button. But again, already that's started to ease, so it's much quicker. I'm going to move in a little bit then. That feels quite a bit stronger for me. So when you're looking for your trigger points, move around just as I am now, looking for those tender spots which feel muscular, that refer, maybe even give you your symptoms, and we just hold it for up to 90 seconds until that starts to settle. You want to spend several minutes doing these trigger points, about 4 or 5 on each side. And then we're going to get back into the massage. So I'm going to take my hand away now that's completely settled, and we're going to come back into a good sweeping motion all the way around. So I'm running down my left hand side, gently across, firmly up. When you visit a body worker, they may get more further into your visceral release. So you can look at womb massage, bladder release, diaphragm release. But I wouldn't attempt doing that on your own. I would stick to what we can feel superficially in those muscles. When you've worked all the way around again, pressing firmly into your tummy in these circular motions, we're going to come into a little side bend stretch. So I'm going to step my left foot up in front. I'm going to ease my elbow down onto my left knee and then stretch up and over through my right arm. Straight away I can feel that same line pulling and tugging a little bit into my low back along that line as well. And I'm just going to hold that and breathe. If I tuck my tailbone underneath me even more, that comes right up through the front of my hip flexors. We're going to hold that and breathe. Each side of this stretch is going to take 1 to 2 minutes for it to completely relax. Over that time, I can already feel I'm starting to get a bit further as that muscle creeps, as it lets go. Okay, now I'm going to change sides. So stepping my right leg forwards, placing my right elbow down, my left hand up and over, tucking that tailbone, maybe even turning up towards the sky, feeling that line again down the front of my tummy. Hold and breathe. As I breathe, I'm going to try and expand into my rib cage. And coming back out of it. And that's it. So it's some self-treatment for you, for your tummy, to support your healing and your recovery. If you do have a caesarean section scar as well, please check out